So should you get a Medicare drug plan? It's actually a very good question and something you need to understand coming into Medicare because there's many different pieces. Do you need to get a Medicare drug plan? And like some of the other choices you'll have, it really depends on which road you take when you come into Medicare, whether you choose Medicare Advantage or whether you choose to stay on original Medicare, Part A and B with a supplement. You would likely get a drug plan, and that's absolutely what I recommend is original Medicare with a supplement. Just gives you so much control over what you want to do. But if you come into Medicare and you're going to choose Medicare Advantage, then likely that Medicare Advantage plan probably will include a drug plan as part of their coverage. So it's owned by a private insurance carrier, the Medicare Advantage plan. So they have their network of doctors, their network of hospitals, outpatient, all that stuff. They also have their own drug plan. And that can be a little problematic because when you tie things like that together, you may do really well with one piece of it, but you may not do that great with another piece of it. And all those pieces are certainly important. So it's important to understand that, especially with a Medicare Advantage plan, that, you know, because your doctors are in the plan, the hospitals are in the plan, the drug plan that's part of it also needs to fit what you take in medications, because drug plans are completely different. They can cover things in vastly different ways, tier 1, tier 2, tier 3, deductibles and things like that. When you're with original Medicare, it's separated. So it's a separate piece than a Medicare supplement plan. So you can tailor it more specifically to what you need. And it's really not complicated. Now, whether you should actually get one is kind of a different story. It depends on your feelings on this. I had a video a while ago where I kind of showed how I would not get a drug plan if I didn't take expensive prescription drugs, because you kind of are paying for something you're really not going to use. But since that time, the cost of drug plans have come down significantly. The lowest one used to be about $20 a month. Now it's about $7 or $8 a month. So it's much less out of pocket to have a drug plan, even if you don't currently take prescription drugs. So let's talk about, if you don't get a drug plan, what happens? And you've likely heard that there's a penalty later if you don't get a drug plan. That's absolutely true. So if you come into Medicare, you stay on original Medicare, Part A and B, and you get a supplement, but you don't get a drug plan because you don't want to pay for it because you don't take any prescription drugs, that's okay. And the good news is you can get a drug plan at the end of any year during Medicare's open enrollment without any medical questions. So you can always get one at the end of the year, but there is a penalty if you didn't do it when you first came into Medicare. And that penalty runs 1% per month that you don't have it. So it sounds kind of big, but it's not really that big of a penalty when you put the math together. So it's based off what they consider the median cost of a drug plan, which it's somewhere around $30. And I'm not really sure where they come to that median because I don't often see that in Medicare drug plans. But so let's take the $30. So it's 1% per month. So in other words, the penalty is going to be 30 cents per month or $3.60 per year. So if you stayed on Medicare, you didn't have a drug plan, and 3 years from now you wanted a drug plan, it would cost $10.80 more than what it should. So if you come in and then you get a drug plan that costs $20 a month, it's actually going to cost you $30.80 a month. So hopefully that kind of clears up. And again, back when premiums were $20 a month for the lowest plan that you would buy, really just to avoid the penalty, it's a tough choice because that's $240 a year that you're just paying to avoid the penalty in the future. But now that prices are much less, where you can get a plan $7, $8 a month, you know, it likely makes more sense to have a drug plan, even if you're not going to get a benefit out of it, to avoid the penalty in the future if things change and you do have expensive medications that you will need a drug plan to help cover the cost. You know, these days, there are so many different discount prescription drug programs out there, from GoodRx to the thing Mark Cuban just put together, to Walgreens has their own discount programs. You know, a lot of times you can do better in those discount programs than you can with a drug plan. So, well, one of the benefits to having a drug plan, even if you're not going to get them to pay for your drugs, so if you have a $7 plan, it's going to have a big deductible, and you're not likely going to get much payment from the insurance company for your drugs, but there are reduced prices on the drugs. So they do have pre-negotiated rates, just like using a doctor in network. They've already negotiated discounts into the cost of medications. So even if the insurance carrier is not actually writing a check for the drugs, they have reduced the cost. So it can absolutely make sense to have that. A lot of people certainly sleep better knowing they've got everything buttoned up, but that's kind of where it is. And if you're going to get a drug plan, I have a video that walks you right through it. Medicare has a terrific site that makes it really easy to see. You put in your zip code, your basic information, the drugs that you take, and it will show you the best value of a drug plan. Best value meaning including the premium costs, the drug costs for the year, their deductible costs for the year, everything put together, it shows you what's the best one. So I made a video that walks you right through that, and I also made a URL if you want to go to do that. It's just drugplanfinder.com. So if you go to drugplanfinder.com, it takes you to Medicare's site, so nobody's selling you a bunch of stuff. You can put in your information, and if you want the drug plan, you click enroll right there. It's super easy to do. So I hope you found this helpful. And my recommendation changed where I would not get a drug plan before, but I likely would now since it is lower cost, and that way we don't have to worry down the road if things change and things get expensive, so we don't have any penalties and things like that. Hope you found this helpful. Show you how to download my free book, Medicare Made Clear. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be, and likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at medicareonvideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.